All right, y'all. I've got 10:01, so in the interest of everybody's time, I'm going to go ahead and get us going this morning. Welcome. My name is Jared Burton. I am the coordinator of the DuPage County ROSC. Welcome to the very first DuPage ROSC presentation series of 2024. We are glad that you could make it. Hope that everybody had a wonderful holiday season. Hope that you're staying warm. And thank you for showing up to learn a little bit about Xylazine today. For those of you who maybe are unaware of what a ROSC is. I'm going to go ahead and just give you the Cliffs Notes version, but a ROSC is a coordinated network of community-based services and supports that is person-centered and kind of builds on the strengths and resiliencies of not only individuals, but their families and the community at large, not only to kind of, achieve recovery from substances, but also just improved health and wellness overall. So ROTS gets together a couple of times a month. All of y'all are across that spectrum, that continuum of recovery. Some of us work for organizations that deal with substances and co-occurring mental health. Some of us are people in recovery ourselves. Either way, we're glad you're here as we kind of build up a culture of recovery in DuPage County. So we're glad you could make it out. The DuPage ROSC presentation series, if you've not made it to one before, is a way for us to dig a little bit deeper into specific topics. If you've attended our DuPage ROSC Council meetings, we have presentations there, obviously, but that's kind of spotlighting maybe local organizations or kind of some specific projects and groups that are going on in DuPage County. These topics are more a little bit broader, but also it gives us some time to really dig into the topic and maybe have some conversations around some things that are happening in substance use and co-occurring mental health, and maybe, start some of these conversations. And this gives us the time to do that. So again, thank you for coming. Just a couple of housekeeping things. If everyone could make sure that they are muted, that would be great as far as keeping down interruptions and things like that. We will definitely have some time for conversation and questions and stuff at the end. So if you have a question or anything, just try and save it. Otherwise, we will definitely get to you. We are recording this. We record all our meetings. So if you ever are unable to make it or you want to share this with somebody, we do put it on our YouTube page. So I do want to share a couple of things just before we get into the presentation itself. So if you'll bear with me here. All right. So the first couple of things, DuPage ROSC, DuPage RCO, and our lead agency, Serenity House, we are looking for some people to fill some positions. We were looking for certified recovery support specialists, also known as recovery coaches, and also transportation techs, which are van drivers. This is a great way to kind of get your foot in the door and working in the recovery field. As you can see there, I got some information up just about some of the benefits and things like that. This is on our Facebook page. If you're ever interested in kind of keeping up to date with what's going on, you can find it on the Facebook page, or you can scan that QR code right there and you'll be able to go and find out more information on that. So I can say, and there's a bunch of us on this call from experience, you'd be working with a cool group of people. So if you're interested, definitely check that out. I also want to promote a couple of events real quick. Some sober events coming up. Sober Skate. This is coming up on January 21st at the Coach Light Skate Center in Roselle. This has been going on for a couple of years. Our friend Mark Matthews, who now works at Kenneth Young Center, has been putting this on for a couple of years. Information there, $10 for adults, $5 for people under 18. You can bring your own skates or rent them for $4. All of the proceeds go back into the recovery community. Mark has also done a great job of collecting socks for us in the past for some of our winter clothes donations. So if you're interested in going, maybe think about bringing a pair of socks to donate. I always say this when I talk about the socks thing, as someone with lived experience of spending a lot of time outdoors, even something simple like a new pair of warm socks goes a long way. So if you're interested, definitely go check that out. But also coming up on Saturday, January 27th, we have our DuPage ROSC game night. So we're holding that here at Serenity House in our big hall. If you've been to one of our ROSC meetings in person, we hold them in there, and there's a giant big AV screen. We're going to be playing video games on that, definitely playing some Mario Kart, probably some Mario Party on another TV. We'll have card games. It's going to be a whole lot of fun. This is open to the public, so 7 to 9 p.m., totally free. Come on out to Serenity House and join us for the game night. I didn't bring my my Mario Kart trophy to show off like I did last time, but there's definitely a trophy. So you will want to make it out for that. So let me stop share for a second. I do want to throw it over real quickly just to Danny Sorbis. Danny, do you want to just real briefly mention the WhatsApp referral hub? Because I think we do have a lot of people here and some people may not be hooked up with it. Do you want to just give a brief rundown of that before we get into the presentation?
Sure. Good morning, everybody. Um, we have the WhatsApp referral group, now referred to as the Referral Hub. It's almost coming up on a year that we started it, February 1st. How it initially started was a group chat of 17 members from the community, different organizations who were reaching out to each other regarding referrals. They didn't want people to fall in the gaps, missing treatment if somebody needed to get into a detox or residential or PHP, so on and so forth. But what we found is that adding people to those group chat to the group chat from different providers, Samsung, versus iPhone, it made it a lot more difficult. So we turned it over to WhatsApps, and we are now at 70 plus members, which is amazing. We've been able to help a lot of people thanks to the thumbs up and the clapping, Ben. If you guys are interested, have any questions, or want to be a part of it, I'll put my email in the chat again, and we would love to have you. But it's non-invasive. You don't have to respond to anything, or you can respond to everything, just whatever pertains to you, with openings or referrals that you can assist with.
Excellent. Thank you, Danny. We really appreciate that. All right, so we are about to get into our presentation here. Real quickly, before I start, I just want to take a quick pulse of the virtual room here. And you can, if you want, if you're on video, you can raise your hand, or you can raise your tiny digital hand. There's an option for that. But how many people here on this call have heard of Xylazine before? Okay. So a few. I see quite a few of you who work with me, and I've been hammering it for a while, so there's no surprise there. Okay, so a decent amount. Okay, so what we're gonna do, thank you everybody for interacting there. I'm kind of treating this as kind of like a Xylazine 101. If you have attended or been a part of one of our ROSC or RCO Narcan trainings before, it's going to run kind of similar. For those of you who are familiar with Xylazine, this may just be a brush up. For those of you who have never heard it, you're going to learn a lot today. It may not go all the way till 11, but that's fine. I am interested in having some conversations at the end. So we're going to go ahead and get into it. And bear with me. For some reason, when I was sharing my screen, for some reason, I don't see the video from you guys. It just shows me my screen, which is fine. It seems to be working. But if something comes up technically, I won't see you frantically waving at me in the video. So just please put it in the chat if something comes up. So I'm going to go ahead and share my screen now. That's cool. And if everybody could just make sure you're muted, that would be fantastic. All right. I'm going to go ahead and start this. All right, so Xylazine, the growing threat and treatment challenges. So first of all, what is Xylazine? So like I said, a lot of you tend to know already what it is, but for those of you who don't, so Xylazine is a non-opioid veterinary tranquilizer that is currently not approved for human use. Very important to stress that, not approved for human use. Goes by a couple different names. Tranq is the most common. So it is technically a central nervous system depressant. That can not only cause drowsiness and amnesia, slow breathing, heart rate, and blood pressure, lowers that to some very dangerously low levels. But tranq is one of those terms on the street you'll hear, and that is usually what it's called when you hear it referred to tranq. That's talking about something that's xylazine cut into it. Xylazine is linked to a really increasing number of overdose deaths nationwide. And we will talk numbers here in just a little bit, but that is a huge part of what's causing an increase in some of these overdose deaths, especially on the East Coast. Studies are showing that people who are exposed to xylazine often knowingly, or very important, unknowingly use it in combination with other drugs, particularly fentanyl. I have, in doing research for this conversation, I have done a lot of finding interviews with people and studies on people who have been using trank dope, who didn't know it was in it at the beginning, didn't want to use it if they knew it was in it, but are now hooked on it. So a lot of times people unknowingly are ingesting this, very similarly to what it was like when fentanyl first started showing up into the opiate supply. So kind of the history of xylazine, originally developed by Bayer in Germany, which is just a normal pharmaceutical company. Bayer makes aspirin, amongst other things. But they were looking to develop something as an anesthetic for veterinary procedures. They did do trials in humans, but those trials were shut down because of the way the drug was leading to the respiratory depression and really, really low blood pressure. So even from the beginning, they could tell trials in humans, this really wasn't fit for human consumption. It was really first noted as an adulterant down in Puerto Rico. So this was in the early 2000s. DEA has been doing reporting on this and lab analysis of drugs down there. Xylazine was popping up in the opiate supply in Puerto Rico in the early 2000s. And even now, a decade later, still documented down there, not only as a drug that's mixed in as an adulterant, but a drug of abuse on its own. So very documented that people down there are actually choosing to use xylazine on its own as a drug of use, which continued to this day. So back in 2011, a study observed that people really in rural areas, so it was kind of in the farming areas of Puerto Rico, were injecting what they called anesthesia de caballo. And please forgive my bad Spanish, but literally that means horse anesthesia, and started to develop severe skin ulcers. Let me take a minute just to say, because I didn't say at the beginning, we will get to a point in this presentation where we're going to talk about some of those skin issues that derive from using xylazine. And hopefully right before that slide, I'll kind of give you all a trigger warning if someone's maybe a little bit queasy about seeing images. I'm not using these images down the line as any kind of sensationalist way, but it's just informational, showing some pictures of what happens to people's skin when they use this stuff. So I just wanted to give you all a heads up before we even get close to that. But from 2002 to 2008, it was actually associated with a huge number of inmate deaths down in a prison in Puerto Rico. So back in 2002, when these inmate deaths started happening, this is when they started to say, well, what is this stuff? What is this drug that's killing people down in Puerto Rico? And it really started setting off alarm bells. So kind of an interesting ground zero from where xylazine started coming from. I'm going to show a very, very quick video. This is only about 2 minutes long. It kind of talks a little bit about that use down in Puerto Rico, and gives a little bit of the history of that. So let me go ahead and play this for you guys.
Just like New York City, Puerto Rico has groups that provide clean needles and Narcan to drug users. But Puerto Rico was first.
Whoops. There we go. Let's try that again.
Just like New York City, Puerto Rico has groups that provide clean needles and Narcan to drug users. But Puerto Rico was first to see the horrors of trank mixed into its heroin and fentanyl supply.
What the media dubbed as the zombie effect, which is they are mostly bent over.
And more than 10 years ago, El Punto en la Montaña, a harm reduction group in PR, saw alarming images similar to what we witnessed in Philadelphia, with skin ulcers leading to amputation.
It was a reality, it is not strange for me to see that.
Now, New York City has concerns street scenes from Philly could become part of our reality. Kaylin C. is testing drugs in East Harlem at On Point NYC.
Some samples testing as high as 20% for xylazine. We can say definitively that we are seeing an increase in xylazine in the drug supply in New York City.
Sam Rivera is director at On Point.
We're working with Philadelphia as well. We're going to Philadelphia to collect some of the supply to then measure it against what we're finding here in the city.
Gladys Nieves Vasquez said she hasn't seen the zombie effect recently in her region, but terrible skin sores returned in the last year that get much worse quickly. She mentioned one particular case.
It was already covering most part of their arm. And months later, they have to receive an amputation.
The organization, based in Caguas, reached out to the University of Puerto Rico for help.
We are not able to test the drugs to see if they contain xylazine.
And Nieves Vasquez told us the University of Puerto Rico is still trying to get reliable test kits for xylazine.
So as you can see, Puerto Rico is kind of the ground zero for a lot of this use of xylazine. But how did it get up to the US and kind of where we're at now as far as the issue? Kensington. So Kensington might be a neighborhood some of you all have heard if you watch the news. It is a neighborhood up in Philadelphia, which has a substantial Puerto Rican population. So if you kind of want to trace where xylazine has come from, if we're looking at ground zero down in Puerto Rico, it made its way up through the Puerto Rican population into the US into Philadelphia. So xylazine was kind of first found up there in 2006, but it wasn't around till around 2018 that tranq use really began escalating. And then not only in Philadelphia, but throughout the Northeast US. And that news story, they talked about it being in New York as well. The theory is that a lot of this escalated during the COVID pandemic. So bottles of xylazine, which you could purchase online just with a veterinary prescription or easily diverted from different supply chains, it really became popular as a cheap, easy opioid filler. So obviously, as I said, if you had a veterinary prescription, you're able to get it. But also any number of chemicals like this can be ordered online through Chinese vendors. It is very easy to obtain just because of the way it's not scheduled as a narcotic. So COVID really exacerbated things as far as people being able to obtain this stuff, but also cut it into the drug supply. So what they found was in Philadelphia, where much like the rest of the country, your kind of entry-level bag of maybe heroin or fentanyl would go for $10. They began to sell bags of this tranq dope, which were for $5 at the same time. So think about that. If you're someone who's struggling with opiate use and you're struggling to maybe scrape together $10 to buy a bag of fentanyl, and someone says, "Hey, I'll sell this to you for $5," it's pretty much the same thing. That's really a no-brainer for a lot of people who are out there using. So that was an entry for a lot of people to start to become hooked on this stuff up in Philadelphia and in the Northeast. What are some of the current trends? So we're still trying to figure out kind of the full national scope of how this is affecting the overdose deaths overall. And we're still figuring out, as I said, that news story, how to test some of this. There are xylazine tests now. For those of you who have come to our ROSC meetings, you know that we distribute xylazine test strips, and I'll talk about these at the end, but this is a relatively new thing. But the use of xylazine in some of these overdose deaths rose nearly 20 times between 2015 and 2020 in all the major regions where xylazine was actually being tested. So again, the highest prevalence was observed in Philly. That was involved at about a quarter of all deaths, followed down that corridor there by Maryland, which is mostly Baltimore and Connecticut. So fentanyl was present in, as you can see there, almost 100% of the overdose deaths involving xylazine at about 98%. So mixing this xylazine specifically with fentanyl is just a recipe for disaster. But in 2021, 90% of the samples of purported heroin or fentanyl in Philly also contain xylazine. So think about that. 91% of all the samples in one city contain xylazine at this point. This was back in 2021. You have to imagine that it maybe has even raised since then. They're still doing the testing, but it is the most common adulterant in that local drug supply. Here, what about in Illinois? Well, in the Cook County Medical Examiner's Office, in the 146 opioid-related deaths last year, where xylazine was listed as a cause, making that a 16.8% increase from 2021. Again, these are preliminary numbers. These will likely increase as there is 564 pending tox screens that they still have to get through from last year. So this is only going to increase in the numbers for the next year. How does it work though? So the way it works, it's absorbed, metabolized, and eliminated pretty rapidly. There's different ways that it can be ingested. It can either be inhaled, so it's usually smoked, or intravenously, which is used in combination with an opiate through an IV. The most common route of administration, though, is injection. The action can usually be seen about 15 minutes to a half hour after administration. The sedative effect of it may go on for 1 to 2 hours and last up to 4 hours. Once the xylazine does gain access to the vascular system, it then just goes on distributed by the blood to enter the heart, lungs, liver, and kidneys. One of the really interesting kind of anecdotal things I saw as I was watching these interviews with people who were using trank dope. They would report after using, whether that was smoking or shooting up, like blacking out for hours, only to wake up kind of already in withdrawals from the fentanyl, which is a short acting opiate. So think about that too. If you're an everyday user struggling with this stuff, you're doing what you can to not be in withdrawals. You use this trank dope, you're knocked out for a couple of hours, you wake up and you're already feeling sick again because the fentanyl is so short acting. So you can kind of see how that cycle perpetuates itself and becomes really dangerous for people who are using trank dope. Its effects on the body, it's going to have that sedative effect. So similarly, dry mouth, drowsiness, hypertension, as well as tachycardia that gets followed by hypertension and all those other heart issues we list there, up to and including coma, respiratory depression, etc. Coupled with the opiates, though, really does increase that likelihood of overdose. One of the most common and severe human reactions to xylazine is that of necrotic skin ulcers. So necrotic means this kind of irreversible condition where body tissue dies. And we are going to kind of get into some of that skin condition here. So let's jump into that. The effect on the skin. So skin infections and necrosis. So frequent xylazine use is associated with this higher prevalence of skin problems, mostly involving these abscesses, but also ulcers and infections. This is compared with incidents of skin infections among people who use drugs but don't use xylazine. So people who use IV fentanyl or heroin, there's always a risk of coming down with some kind of skin issue, whether that's an abscess, an infection, or whatever, just by using IV drugs. So whether that's not using a clean needle, living out on the street where things can get infected. This really increases that chance. And it is really a major symptom of using xylazine. So that kind of raw, crusty skin ulcers that spread out from the injection site, the skin wounds do decompensate pretty quickly, and they can be so severe that the infected body part can require amputation if left untreated. You'll see this if you watch news stories about xylazine users. There is a large percentage of them who do unfortunately get to the point where they require amputation, and they will continue to use. It is a very vicious cycle for them up there. Again, watched a video where there was a person living on Kensington Ave up in Philadelphia who had already had 3 body parts, I believe both hands and a foot amputated, and was continuing to use. So you can see this is just a horrible side effect that's happening from use. This is the most important part of that skin effect, though. These can occur from multiple types of xylazine ingestion, not just injection. So this stuff can occur for people who are smoking trank dope or snorting it. Just the effect that it has on your body, sores and abscesses can show up in your body even if you're not shooting it up, even if it's not an injection site. And we're finding that out more and more. So again, although the injection of other drugs is associated with skin abscesses, the xylazine skin lesions are distinctly different and dangerous in some different ways. So the xylazine-related lesions are not just restricted to those injection sites, often appear on the lower legs between the knees and the ankles. These wounds can resemble chemical burns. They do require some significant drainage, and they will have a foul smell. These wounds are very likely to become necrotic, which is going to appear as a scaly, black dead tissue. These wounds can take months or years to heal and are unlikely to heal without medical care. People who are in recovery from trank dope, you'll often see sometimes their arms and legs are still in the process of healing months later. They resemble burn marks. They resemble second and third degree burn marks on the arms. And when we get into the pictures, there is a photo of someone who is healing from that, and you can kind of see what that looks like. These wounds can penetrate down to the bone, again, necessitating amputation. These are very, very serious wounds. So these are the photos. Again, not anything pretty to look at, but this is just the reality of what they're seeing out on the street where trank dope is being used. Down on the bottom right, you will see that is the arm of someone who is almost in recovery for a year. So a year later, it still resembles very, very serious second and third degree burns. The necrotic tissue in some of these people will require amputation if they do not, seek medical treatment. And, there are harm reduction organizations on the street down there that are helping out with wound care, but sometimes it goes beyond that. There is a definite medical need for these people to go seek out with this stuff. What about the actual overdose stuff though, right? So combined with fentanyl and other synthetics, it just increases a huge amount the potential for fatal overdoses, as it kind of has that similar effect on the body and can further reduce the already decreased respiratory function. So, as we say in our Narcan trainings, with things like fentanyl and heroin, central nervous depressants. So the breathing's already going to be slowed just to the use of that stuff. So when coupled with something like xylazine, it makes it even more dangerous for the respiratory function. The overdoses can be more difficult to identify, even in clinical settings, because they can really appear similar to opioid overdoses, and are often not included in those routine drug screening tests. Now, again, as I said, there are testing methods now, but they are rolling those out. This is not something that's largely available to the public. There is no approved antidote currently for human use, and xylazine is not an opioid. Naloxone, aka Narcan, does not have a reverse on its effect. So we found this out a few months ago when xylazine first started popping up. And we had to add that to our Narcan training pretty quickly when we started talking about trends and things like that. And that is one of those facts when I do trainings for people that just, you can see their eyes get wide, because it's a scary thing, right? If this is something that's kind of slowly making its way into drug supplies, not only on the East Coast, but making its way through to the Midwest as well, we're having a hard enough time using Narcan to keep up with the strength of fentanyl and other things. So now to add another adulterant to where something like naloxone's not even touching it is a very dangerous thing. And as I said, currently there's no reversal for it. So consequently, the presence of xylazine can render that naloxone less effective. But we do say to administer it anyway, because it is going to address the opioids that are in the system. So we're not saying that, just because there's no use for naloxone and xylazine, that to not bother. Yes, always bother. Always use naloxone or Narcan if you suspect an overdose. We're just looking at ways that we can work on something that has no antidote for a reversal. So physical dependence and withdrawal. This is another thing that was very scary as I'm doing research on this stuff. While there isn't a defined use disorder that's associated with xylazine yet, the kind of unintentional or intentional use of it contribute to a really, really serious physical dependence. Withdrawal symptoms do occur. They occur when someone decreases or just stops. Some of the symptoms of that withdrawal may include kind of a non-specific anxiety, the high blood pressure, increased heart rate, sweating, restlessness, agitation, and irritability. So they're finding that it's kind of mirroring withdrawal from like a benzo. And it is very, very serious and very, very hard withdrawal. Since it is a depressant, the withdrawal can be very intense and painful. It is always recommended for have a medically supervised detox program if xylazine has been something someone's been using for a prolonged period of time. Again, anecdotal reports out of some of these areas, people reporting even just the physical symptoms of a xylazine withdrawal can last up to a month. So couple that with some of those intense mental withdrawals, so including that anxiety, the agitation, the irritability, a lot of times when you're looking at a month-long withdrawal process from some of this stuff, that is easily something that's going to scare people away from wanting to seek a detox because of how serious it is. The only other drug or substance that I've heard of, having a physical withdrawal lasting that long is something like methadone, which has a very long half-life and builds up in the body. But they're seeing that with xylazine withdrawal reports. So how are we going to treat this stuff? So if there's no reversal for it, if this is something that's a very long and painful and prolonged withdrawal process, how are they even treating this stuff right now? So they're still kind of finding out the best ways to treat someone who is trying to come off of xylazine. The opioid withdrawal, especially if it's coupled with that xylazine, the opioid withdrawal, because of the short-acting nature of it, especially fentanyl, that is going to precede that xylazine withdrawal, although sometimes they do happen around the same time. So some of those early symptoms of anxiety and irritability and restlessness will overlap with the opioid and xylazine abstinence syndrome. So the initial symptoms may begin about 6 to 12 hours following the last use. The xylazine withdrawal may conflate the use of COWS scoring to determine buprenorphine readiness, basically meaning using that COWS score of withdrawal to determine if someone's going to use Suboxone to kind of deal with those opiate withdrawals. So where's that problematic is that if you're confusing the xylazine and the opioid withdrawal, that can cause some problems on when to get somebody started on Suboxone. And somebody with a really heavy fentanyl use, the xylazine withdrawal may occur first, and it may be interpreted as part of that opioid withdrawal. But a hallmark of the xylazine withdrawal is that like additional doses of a full agonist opioid does not improve the symptoms of withdrawal whatsoever. So doctors are still trying to figure out the best way to treat some of these withdrawals, especially if it's been coupled with something like fentanyl or another opiate. As far as medications that they're using to treat some of this stuff, for the pain and opioid withdrawal management, that's not changing. Things like buprenorphine and methadone, and or kind of the shorter acting opioids, specifically for that part of it. For the treatment of the xylazine withdrawal, though, they've tried a few different things to various degrees of success. Clonidine, which is antihypertensive, which is also kind of used in some opioid withdrawal as well. Gabapentin, which is an anticonvulsant, but is also used for different things, off-label for anxiety and some other things like that. But also they've even tried ketamine. Now, obviously, they're going to try ketamine in a non-ICU setting. You're not going to present to most ERs with withdrawals from trank dope, and they're going to get you hooked up to a ketamine drip. But they are trying that in some non-ICU settings. For that kind of restlessness and agitation, I won't list all of them for you guys. You got them up on the screen there, but some of these antipsychotics, antihistamines, but also stuff as strong as like lorazepam and phenobarbital. And that's because some of these withdrawals from this stuff is so bad that they're having to give them high levels of some of these medications. As far as the wounds, as I mentioned earlier, the harm reduction groups in places like Philadelphia and New York are really, really pushing the education of wound care. And that's almost, they're doing that just as much as like Narcan training these days because of how prevalent the wounds are. So real easy, some of these best practices as those of us who maybe work in the field or know people who are still struggling with substances, if we come across someone who maybe is having these wound issues, if they're as bad as some of those photos, right? If we start to see necrotic skin, we obviously want to get them to professional medical settings. But if we're able to kind of help them with some wound care treatment, just your basics, always make sure we're cleaning hands with soap and water before touching anything, using sterile gloves. We want to gently wash those wounds with soap and water or with saline, so just salt water. Ointment, if we can, onto a bandage, onto the wounds, and then wrap with more dry bandages, making sure that it's lightly wrapped and not pressing. And then just make sure it's covered up, make sure you're cleaning these and changing the bandages every 2 to 3 days. Again, that's if we can't get them to a medical professional and we're just trying to help them in the meantime. Again, treating this stuff early is key. These wounds can heal if we give them the right support. Want to make sure the wounds are clean and covered. Try to avoid stuff like alcohol and peroxide because they can dry things out. Wash them daily with warm water. Again, petroleum jelly, things like that. Change them whenever possible. These wounds do heal slowly. And the way that they've been measuring this stuff is you can draw a circle around each wound with a marker to kind of track whether or not it is shrinking or growing. Again, seek emergency medical care ASAP if you see or experience like any of the symptoms of infection, fever or chills, severe pain, skin that is red, hard, hot to touch, discharge, some of that gross discharge. And then obviously, if you get to the point where pieces of skin are falling off or bone is showing, obviously they need to be into the ER or an extreme medical setting at that point. So having seen all of that, what are some of these barriers to treatment for people that are currently stuck in that cycle of use of trank dope? The first barrier, as I said to a lot of them, is just a long, painful withdrawal process. I'm going to speak from personal experience. I am not someone who has experience using trank dope, but I am someone with experience with opioid use disorder. And even the painful withdrawal process of that alone is enough of a barrier to keep people from going to treatment. So to increase that, not only the time frame, but the physical and mental anguish of that withdrawal process is only going to increase that barrier of getting people to want to go to treatment. This is going to get better over time, but currently a lot of hospitals and treatment centers are just simply unprepared to handle xylazine cases. That's not through any fault of their own. It's just lack of cases that they've handled so far. And just sort of lack of education as xylazine starts to seep into different areas across the country. Again, those severe skin wounds that require medical treatment, sometimes that trumps it, right? If I have got a wound, I've got a bone showing, obviously I want to make sure I get that treated first, or at least the very least concurrently, but that can sometimes be a barrier to seeking treatment for the withdrawal portion of it. Really importantly, stigma related to use. A lot of people who are interviewed who are dealing with this stuff report a huge amount of stigma when they report to ERs and detoxes. That is nothing new. That is something that stigma has existed in medical settings for a while. But now that you have increased the the danger of things like these wounds and showing up, that stigma is only increased in those areas. Obviously, the acute and post-acute anxiety and depression, which is doubly horrible coming off of this stuff. And then you just see some of the same barriers that we see, right? Lack of insurance, lack of transportation, need for trauma-informed care based on their particular situation or where they're presenting to. And really, really importantly, and I'm going to get into this last bit here, stigmatization due to media portrayal. This is something that I have come across that is frustrating, and it's something that I think maybe some of y'all have seen too. And they've given it a name. Some of the harm reduction groups have given it a name called trank tourism. Trank tourism is basically the sensationalization of the situations that we're finding in these areas where people are using trank dope. I don't think a day goes by I can't Google just the phrase xylazine and look at the news filters and see stories like this. I just randomly searched xylazine and trank on YouTube yesterday, and these were some of the first results that showed up, right? So what are some of the common through lines here? Zombie-like, right? Life in the city of zombies, zombie apocalypse in the United States. This is kind of what we're seeing when we're talking about xylazine, right? It's kind of the sensational part of things. And if you're someone who knows nothing about xylazine and you see these things, right? Of course, that's going to maybe increase some stigma when thinking about people who are currently struggling with this stuff, right? The really frustrating part, I mean, this is just a very, very small handful of videos you can find right now. If you were to search, there are thousands of these on YouTube. But there are even things like live streams. I found this yesterday. If you go on YouTube and search Kensington, Philadelphia, these are all different live streams where YouTube content creators and newsmakers have set up live cameras down there that are just showing footage of people who are down there struggling with use of trank dope. and these things run 24/7. And this is the type of stuff that just increases the stigma, and that stigma will in turn increase those barriers to treatment, or will increase or decrease the chances of someone really digging down and say, I want to change, right? Because look how they're portrayed. You know, there's nothing dignified in any of this. And I really appreciate the work that's being done by harm reduction groups down there, not only just because of the hard and tough work they do, but in confronting stuff like this. I recommend anybody look up a group called Savage Sisters that's in Philadelphia. They've been down there for years, working with trank people who are addicted to trank, not only cleaning wounds, but helping them find services and other things that harm reduction groups do. But they will confront people who go down and try to profit off of this stuff. And it's a very sad situation, and this type of stuff can only keep us from really trying to make a difference and make a change and lower stigma for people. Again, thank you for letting me present on this stuff today. Doing the research for this over the past, few weeks, but really months, as we started to see xylazine come into our area, has really been eye-opening. Not only is far as dealing with, okay, how are we going to approach this? How do we approach the treatment process? But how do we talk to people about it, and how do we make sure that we're reducing stigma when we talk about this stuff to people? Again, we distribute strips. If anybody is interested in having strips for their organizations, or if you or somebody you know continues to use and you want to have strips on site, just let us know. You can reach out to us at any time. We're happy to distribute those to y'all. If you haven't used them yet, they are very simple to use. They're much like the fentanyl test strips. It's just a simple dipstick test. You scrape off a little bit of a sample of whatever drug that you're testing, add a little bit of water, stick this in it, and then within a couple of minutes, you'll find out whether or not there's xylazine in it. So yeah, we're still trying to learn as much as we can. And I know that they're currently working on ways that they can try and reverse this stuff. But in the meantime, all we can do is just stress the need for testing, stress the need for wound care, and stress the need for learning things like rescue breathing, and making sure that we are always using Narcan on people, even if that Narcan currently can't touch the xylazine. So just continue the work that we're doing as far as harm reduction, and try to be as empathetic as we can for those who are still using. So I'm going to stop my share. I do want to open it up for anybody that has any questions or comments. Yeah, thank you for letting me present. I do see a hand, Nicole.
Hi. So my question was, my understanding is that if you present to, let's say, an emergency department, they are currently unable to test whether or not you have xylazine in your system. So I think this would be important for people who are unknowingly ingesting. Is that still the case per your research?
So per my research is that more and more hospitals are able to test for it now, but it really depends on the frequency of use in any given area. So for instance, like all of the hospitals in Metro Philadelphia know how to test for xylazine. All of the hospitals in different boroughs in New York know how to test for xylazine. Some in Chicago definitely know how to test for xylazine. So it's increasing. But you're starting to see xylazine pop up in states like, Alabama, South Carolina, more rural areas where they just haven't seen it yet, so they don't know to test for it. So that's always going to be a problem for people who are maybe presenting in areas where xylazine hasn't kind of filtered in yet. But I know for a fact we're moving quickly up in our area to make sure that, all hospitals know how to test for it at this point. So it's just going to be a process,
Yeah, for sure. Thank you.
Any other questions or
So
comments?
I put a question in the chat.
Oh yeah, let me look at it. Hang on 1 second. Or you can ask, Felicia.
So if someone is initially treated with their wound care, but the wounds are still serious, are they allowed into normal rehabs?
So I would love for someone who maybe is on the call that works at a residential treatment facility to chime in, because I'm sure it is I'm sure it's a case by case basis depending on where the treatment center is. But yeah, does anyone want to chime in with that one based on their employer?
Sure. So at RCA, we would obviously the person would have to be able to be released from the hospital. So if it's like, active infection, they're gonna want to see that that infection is under control. And I think it does depend on, the treatment center individually and like what their staff, can do. Um, I know at RCA, we pretty much take everyone on a case by case. So, it would be a combination of how often do the bandages need to be changed? Is that something the patient can manage on their own, or will they need medical intervention to do that? We have had patients before that are on IV antibiotics. And so we have, transported them for their infusions each day while they're in residential treatment. So it just kind of depends. But I think most of the larger facilities, would probably be open to do it so long as they can handle it.
Respect.
I see John Scoes from CDH Hospital. John, you want to talk about what CDH does as far as wound care stuff?
Yes, thanks, Jared. With our program, even though we're not inside the main hospital, but just because we're on the campus and right next to it, our doctors will put in for the wound care consults. So we'll actually have the wound care department come over and do the wound care for that patient. And if it's something that's, let's say, in a more manageable state, our nursing staff will be able to do most of that for them right here. And of course, the dressing changes and the like. And similar to RCA, we also have the ability for the IV antibiotic infusions. Just because we're a hospital setting, we have that access to those things right here. So our patients will program in our inpatient with their IVs and such as they continue their healing process. If the wound, of course, is too detrimental, then we'll have them on the medical floor, and we work with them whilst they're on the medical floor to continue their care and next step planning. So that's the best I could say from there. So thank you.
Thanks, John. Donna, you got something?
Yeah, I would say same thing. I would agree with both areas. We've had people here before with open wounds, just as long as they can take care of their wounds and staff doesn't have to do that. I mean, due to obviously for liability reasons, because we're not nurses or doctors. If they're able to take care of their own wounds and they're able to follow the program structure, there'd be no problem for them to be here.
Excellent. Excellent. Thanks, y'all, for chiming in with that. Any other questions or comments? Yes, Astrid.
Hold on a second, my dog's barking. Okay, he stopped. So let's say, do you see, I'm thinking, I know someone that has died from an OD of xylazine, and supposedly there were no evidence of other drugs in their system. So this person was previously an opioid use disorder patient. And I'm thinking it's just so scary and possible that here you go, you have someone in recovery, you got a weak moment, you call somebody, you go, hey, I need something and the next thing you know, xylazine is delivered unknowingly and boom, you're checked out. That is so scary.
Yeah, I agree. And again, I do want to stress there's a huge amount of people that were interviewed that were currently in the cycle of use with this stuff who never wanted to be on it, right? If they would have known this stuff was in it to begin with, they never would have used it. And more and more, with adulterants, Yeah, what's to stop someone from just selling somebody Xylazine and saying that it's dope or something, right? It's got a somewhat similar effect on the body, right? But it's you're right. With adulterants like this, it just increases the chance of overdose during a relapse just because of the people's tolerance levels, but also the strength of the adulterants. So it really is scary. And again, because there's no magical antidote for it, the only thing that we can stress is just testing for it, right? If someone is going to use, we always just stress that just please know what you're using. So that's why the more people we can get Xylazine test strips to, the better. Anyone else?
Jared, you may not know this answer. Do you know how many cases we've had in DuPage?
I've got to look that up again because they were still doing the results and stuff. I think we're getting those results in the next couple of months.
Okay.
I think Xylazine's been present, but not like Astrid said that it was the whole kit and caboodle of cause of an overdose. I don't think it. I think like I know.
I think it was in 2022. I want to say I remember the coroner saying there was 6 cases over the past couple of years. So 6 cases where Xylazine
I
was found
mean,
in
like
overdose.
our Nick died of a cocaine, fentanyl, Xylazine overdose. I mean, it's not. I haven't really heard just Xylazine. So Astrid, yeah, that one was new to me to hear of a full on overdose, strictly due to Xylazine. And yesterday, I was on a call and we learned about I talked to Jared about a new drug, Nitazine, that's not new, but to keep up with all the current trends. Thank you, Jared. Like we just have to keep on learning because different times and different drug trends are always happening, and we just have to keep informed. So thank you for this. But Nitazine is a new one. Yeah, we learned about yesterday.
Yeah, there's always a new analog or a new research chemical, and what's troublesome with those is that those can be made in a lab anywhere, you know, so it's difficult to, it's like playing whack-a-mole. I did see a question, something like lymphopenia. I can't pronounce that word. A skin issue be exacerbated by other skin issues complicated by Xylazine. Great question. I don't want to say yes 100%, but we may have to be something I look up and follow up on as far as that specific skin condition. I do want to leave it with this. If anyone is interested in getting Xylazine test strips, we are getting re-upped pretty shortly, like maybe in the next couple of weeks. So if anyone's interested in having some, either personally or maybe just keeping a few on hand for your organization, just reach out to me and let me know, or reach out to Danny and we can work on that for you. But and then the other thing is this. If anyone's interested in doing a presentation series like this for us in the future, we're always looking for people to come and do them. So if there's a topic like you're passionate about, or if there's a topic that you think people in DuPage need to learn more about, we would love to have you. So just reach out to me and we'll get you set up like in the next few months. But yeah, I'm going to record this and then post it on the socials. So share this with people. I think the more people we share this stuff with, the better. So anything else from y'all? All right.
Great job. Thank you.
Thanks, everybody. We'll see you next month, okay?
Great job. Thanks.
Thanks a lot.
Sorry, I did want to say, Jared, sorry.
Yes. No, I'm here. I'm here.
Hi, my name is Brenda Pasia, and I just want to introduce myself. And our organization takes all Medicaid plans. So we're in Downers Grove. I can leave the website there, but I did put my information already there.
Oh, excellent. Brenda, are you part of our WhatsApp group?
No, I'm not.
Would you maybe be interested?
Yeah.
It's we mentioned it briefly at the beginning, but we have a WhatsApp group that's like made up mostly of like people who work in the field, and we help each other with referrals. So if someone comes across someone who's looking for a specific service, we just put it into the group and then work on handoffs for referrals from there.
Oh, okay. We do take PPO, but not HMO. Sorry, but we do take all Medicaid plans. Yeah, I just show there.
Brenda, I'll send you an email if that's okay.
Yeah, wonderful. Thank you so much.
Thank you.
Thanks for coming.
All right, thanks. Bye.
Everybody else, have a great day.